Prepare for the worst, hope for the best. That's the motto San Luis Obispo County health officials are using to respond to COVID-19. For weeks, they have been transforming Cal Poly's recreation center into an alternative care site. KSBY News reporter Megan Healy takes us behind the scenes of that site.
Well, this is not meant to run at full capacity, but rather to take off the pressure from some of our local hospitals. And it's not going to provide just 1 or 2 beds, but nearly 900. In this room alone, about 160. Basketball courts and weight rooms are cleared out to make more room for COVID-19 patients.
The red area is the area where our patients will be.
Patients that are too sick to be at home but not quite sick enough to need major hospital care like ventilation.
If and when the peak hits San Luis County, and we think it will, when the hospitals are severely impacted, this facility will decant those folks that don't necessarily need to be in the hospital.
And if someone at the alternative care site gets sicker, they'll be transferred to a hospital.
We can provide some basic oxygenation for our patients to help them heal because the disease compromises people's pulmonary capacity. We also have 300 oxygen concentrators that are portable we can bring to the patient's bedside.
Bedside outlets will not only let patients plug in and connect virtually to their families, but also help volunteer nurses like Kathleen Young check vital signs. Young works as a microbiologist food lab analyst now, but she's joining the fight as a certified phlebotomist.
Yes, I'm not in the healthcare front anymore, but I can obviously join back in.
As a Cal Poly graduate, she feels compelled to help, or as she calls it, to scrub in.
Battling germs, you're battling a virus that you can't see. So in that sense, I do feel like it's a duty, to help where you can.
Workers will be coming through this tent. They'll take off their clothes and put on their personal protective equipment, exit outside the other.
When it's her time to report for duty at the alternative care site, she'll be greeted with a county stockpile of PPE and strict protocols when entering and exiting treatment zones. These doors behind me are going to serve as the staff entrance. Nearly 230 healthcare workers have already volunteered to serve on the San Luis Obispo County Medical Reserve Corps and can work at a moment's notice. There's still a need for more, though, and there's still time to sign up. Reporting at Cal Poly, I'm Megan Healy, KSBY News.
The ACS will grow in phases. The last phase, if needed, would be constructed in Mott Athletic Center. You cannot walk into the facility. Medical staff says you'll be directed by their county team or a hospital.